That is a session, a new one, on those anatomy videos. In this series, we are going to describe the portal vein, which is the main vein draining the gastrointestinal tract in the abdominal part, and the spleen and the pancreas. As it is formed, this portal vein, when it's formed, it will reach the porta hepatis of the liver, divide into right and left branches, divide and re-divide until it reaches to be the liver sinusoids. These liver sinusoids will be drained by hepatic venules, hepatic veins, which will end in the inferior vena cava. That is the portal vein, which we are going to study. What we can see on the right side here is a CAT scan image of the portal vein. That is the portal vein here, collecting the blood, the venous blood, from the GIT, and then going toward the liver, dividing in two branches for each loop of the liver, and then the venous blood will be recollected by the two hepatic veins to reach the inferior vena cava. That is the portal vein over here, and that is the inferior vena cava. These are the hepatic veins. The formation of such vein is by the splenic vein, which join the superior mesenteric vein to form the portal vein, divides then after that to two branches. Here we can see that is the splenic vein, that is the superior mesenteric vein with all of its branches collecting the venous blood from the different parts of the small intestine and the transverse colon, and the shadow of the inferior mesenteric vein is over here, which join the junction between the splenic and the superior mesenteric vein. That is the formation of that portal vein. That is a cadaveric specimen showing the splenic vein joining the superior mesenteric vein to form the portal vein, the trunk of the portal vein here. That is the splenic vein coming from the spleen. That is the splenic artery. That is the superior mesenteric artery on the left side of the superior mesenteric vein. The portal vein, once formed, lies in front of the neck of the pancreas, which separates it from the inferior vena cava. Then it will go upwards and to the right, behind the second inch of the first part of the duodenum, having anterior to it and to the left the gastroduodenal artery. Anterior and to the left, to the right, will be the common bile duct. Then it will continue in the free border of the lesser omentum. That is the cardiac part or end of the stomach, and the lesser omentum will be over here with the free border of that lesser omentum containing the portal vein. Anterior and to the left will be the common hepatic artery, that large artery. Still on the right, the common bile duct. Then it will enter the porta hepatis, where the arrangement in the porta hepatis will be the most anterior, the common hepatic duct, then the common hepatic artery. The most deep will be the portal vein, which in this case is separated by the caudate process from the inferior vena cava. That is another cadaveric specimen showing the portal vein after it passed the first part of the duodenum within the free border of the lesser omentum, having the common carotid artery anterior and to the left, the common bile duct anterior and to the right. That is the cystic duct, and that is the common hepatic duct. that is the right or the left and the right hepatic ducts which join each other to form the common hepatic. You can see the common hepatic artery divided into left and right branches. That is the right branch here. That is the main trunk, the celiac trunk, and that is the left gastric, that is the splenic, that is the common hepatic. Now, when the portal vein reaches the porta hepatis, that is the porta hepatis here, and that is the opening to the lesser sac, the epibloic foramen. You can see the common hepatic duct and the two right and left hepatic ducts are anterior and to the left and more anterior to the common hepatic artery, and the portal vein is the most posterior structure. That is the arrangement. Anteriorly, the common hepatic with its two branches, then the common hepatic artery, and lastly the portal vein. That is the arrangement within the porta hepatis. Now it will divide into left branch and right branch to be distributed all over the liver, then collected by the hepatic veins to the inferior vena cava. That's the diagram showing the relations which we have described in a diagram here. That is the superior mesenteric vein passing in front of the third part of the duodenum, then in front of the unsnate process, then meet the splenic vein behind the neck of the pancreas to form the portal vein. As they go through behind the first part of the duodenum, they will have the common bile duct, as we said, on the right side, anterior to it. The gastroduodenal will be on the left side. In the free border of the lesser omentum, that is the opening to the lesser sac. And that is the free border where the portal vein will be having anterior to the left the common hepatic, to the right will be the common bile duct, then reaching the porta hepatis, where the duct, the common hepatic duct, will be the most anterior, then the artery, and lastly the vein, the portal vein, which will pass anterior to the caudate process, separating it from the inferior vena cava. Here the opening of the lesser sac separates also from the inferior vena cava. Here it's separated from the inferior vena cava by the unsnate process. But behind the duodenum, it is directly related anterior to the inferior vena cava. So that is the relation of the portal vein to the inferior vena cava. First, superior mesenteric separated by the unsnate. Then the main trunk will be separated from the inferior vena cava by the unsnate process. Then it will be directly in front of the inferior vena cava, then separated by the opening to the lesser sac from that inferior vena cava, lastly separated by the caudate process from the inferior vena cava. The blood, venous blood, will be collected by the hepatic veins to end in the inferior vena cava. That is the relations of the inferior vena cava. Here, the tributaries in another cadaveric specimen showing the superior mesenteric, where it join the splenic, and here is the inferior mesenteric. Then it will go up to go to the liver, dividing into right and left. These are the jejunal and the ileal tributaries. That is the small intestine, the jejunum, and this is the ileum. You can see the arcades, few and the more red jejunum, and there is no arcades here, and more fat, and that is the ileum. So that is a specimen showing that in portal vein as it goes up toward the liver. Here is the liver here. That is the transverse colon, which is raised up to show these structures. That's all about the portal vein. The portal vein have a system which is we call it the portal circulation, which is connected between the capillaries of the GIT to the capillaries or the sinusoids in the liver. So it is between two sets of capillaries. That's why we call it a sort of circulation like the other circulation in the body, systemic or pulmonary circulation. Here, the disease of the liver, like cirrhosis or cancer or whatever, will block the passage of the portal blood to the inferior vena cava. So this will result in portal hypertension, which is a serious thing. The body is arranging itself for such cases by what we call it the portosystemic anastomosis, between the portal blood, which for the GIT, and the caval blood, which for the urogenital system. These are the three systems which are found in the abdominal cavity. So there is a sort of connection between these caval veins or systemic veins and the portal veins. Those portosystemic anastomosis will be seen in the next slide. Here again we come to the tributaries of the portal vein. That is the portal vein here. That is the superior mesenteric, splenic, which you have seen before. And these are the sigmoid, going to the sigmoid colon, and the descending colon. That is the inferior mesenteric. That is the splenic. That inferior mesenteric join the splenic, or the angle between the splenic and superior mesenteric, or join the superior mesenteric itself. So that is the main veins, which are, as I said, the superior mesenteric, the splenic, the shadow of the inferior mesenteric. These are the jejunal and ileal veins. That is the right colic, that is the ileocolic, and this branch is the middle colic, which is this one here. That is the middle colic, which will be along the transverse colon. These are the tributaries of the portal vein. Now, the sites of portosystemic anastomosis, which we talk about. The first site is the abdominal part of the esophagus, at the abdominal part, where the left gastric vein will be anastomosing as a portal branch with the azygos and the hemiazygos vein. These are the systemic. The effect is the development of esophageal varices, which may lead to fatal hematemesis in many cases. The second site is the lower end of the anal canal, which is between the superior rectal vein representing the portal part, the middle and the inferior rectal veins representing the systemic part. The effect will be anal varices or piles, enlargement of the veins at the anal orifice. The third site is many parts at the bare areas of the retroperitoneal organs, or even those are covered by peritoneum but has bare areas like the stomach, the bare area of the stomach, the bare area of the liver, the bare area of the duodenum, the bare area of the ascending, descending colon, and parts of the transverse colon, and also the bare areas of the rectum and the anal canal. All these are sites of portosystemic between the veins of the organ, which is portal, and the veins draining the abdominal wall, which is systemic. And this, according to the site, the effect will be there. For the example, the bare area of the stomach will add to the esophageal varices. It will exaggerate the number of these varices. Varices means dilatation of the veins, and tortuosity of that veins become tortuous and have a very thin wall. So it is very easily ruptured by any effect outside, by injury, by friction of hard subjects like food, like some acid, whatever. So the bare area, according to that bare area, the effect will be the whole bare area of the colon is more effective in this portostomach anastomosis and is very dangerous during surgery if the surgeon does not take care of that. The last thing is an embryonic persistence of the connection between the ductus venosus and the inferior vena cava. That is the left branch of the portal vein with the inferior vena cava, and the effect will be affection on the functions of the liver on those portal blood. On the portal blood, it has a lot of vital functions. And that is all for the portal vein. So, thank you.